We're back with Dr. Bobbitt. Dr. Bobbitt, when you see a patient, how do you go about evaluating them?
This is probably my favorite part of any part of the process. One thing is, the first thing we have to do is sit down and figure out what's wrong. They'll tell us what's wrong, but we want a detailed history, because there's a lot of things that happen to our bodies over the years that we forget or we're not aware of. Oftentimes people think that the condition that they had that just happened, they didn't realize that this thing may have been building up over the years. So the first part of it is to check a great history and get a good consultation. The second thing is, now we have to evaluate them and examine the body. So one of the ways that we do that is we take a spine, and as they lay on the table, we check to see if there are any bones that aren't in the right position, so out of alignment. That's one way. But there's another thing that we do is we check all the muscles and we check all the bones, and in checking those, we'll find out if they're working like they're supposed to. Are they as strong as they should be? We check posture, so if we look, one shoulder might be higher or one hip might be higher. And so once we get the data from the consultation, the exam findings, what we find, then oftentimes we'll even take x-rays. X-rays are real important for us to determine what's going on inside. We want to avoid any complications if we could. So we simply take the exam, the consultation, the x-rays, put them all together, and if it looks like something we can help, then that's what we do.
And so part of your evaluation is feeling the bones of the spine, whether it be the neck, the mid-back, or the low back.
That's right.
What do you do in obese people?
It's the same thing. It's amazing.
Can you feel bones?
Oh, yes.
Even
yes.
if they have 3 inches, 4 inches of fat?
It's so interesting, because as they lay on their back, you can see tissue if it's bigger on one side than the other. If the spine is twisted, you can see it. And you can feel it very, very obviously.
So obesity is not a detriment to your evaluation and treatment?
No, not at all.
So once you've evaluated them, what do you do next? How do you come up with what to do?
Now, once we look at the x-ray, it'll even tell us what position the spine is in. And if the spine is shifted to the left, then we'll do procedures that shift it back to the right. We use, on some conditions, on those that we have to be more gentle with, we have an instrument that we use that delivers a very gentle force. So on children and on our elderly, this is a great tool. But sometimes people, they don't like the idea of having their bones moved, so we utilize something that's like this. It doesn't move the bone in a way that creates any discomfort for them.
So what are the different options available to you?
In the chiropractic field, we have a lot of modalities available. One of those, of course, is spinal adjusting, extremity or joint adjusting. We have massage. We have physical therapy type modalities. However, since we're not physical therapists, we call it physical medicine or exercise or rehab. That's what we'll do. We utilize decompression techniques, and we have special instruments and tools that help decrease pain and inflammation. Nutrition is a big factor. Exercise, counseling. So a lot of things at our disposal. So just because we don't prescribe medication and do surgery procedures, we have a lot to be able to use.
And how many treatments does one typically require?
We get this question a lot. If someone was super acute and they have a lot of pain, it may take several visits to get them out of pain. And once that happens, and if the condition's corrected, then it may only take a week or two to help them in pain. But there are other conditions that people have that they're losing function. They've lost function in the body. They may take many, many more weeks than just a few.
So in an acute problem, the treatment plan would be 1 week, 2 weeks?
Yeah, most acute care, a couple weeks. A couple weeks, they're better and they're ready to move on.
How many times a week would that be?
2 to 3 times a week is ideal in my practice.
And when they're back to their baseline, is that it, or do they need maintenance adjustments?
It depends on what they're looking for. If they're looking for just temporary relief, a week or 2. If they're looking to correct a condition that's been there a long time, it could take several weeks. And then if they want to just maintain for good health, generally we recommend once a month, once every 2 months, and that helps them maintain the spine like it should be.
So what are the risks of adjustments, and how often do problems occur?
One of the beautiful things about chiropractic is the risks are so rare. Most of the time it's soreness from a muscle or from the joints being maneuvered. On rare, there are some complications. Some have been regarded as There's some complications as far as stroke has been thrown out there. The idea that with certain type of adjustment that patients are prone to having some type of trouble there. It hasn't quite been positioned in a way that the chiropractor has always caused it, but the person had a condition that the chiropractic didn't help it, an underlying cause that it didn't help. So we see that sometimes. But most of the time, very rare complications, if any.
That wraps up today's episode. Tune in next week for another exciting edition of Dr. R.